on this episode of A Tale of Two Hygienists.
We're not competing for anything anymore. We're just seriously just getting through the program, and so there's no need to compare or compete with the person next to you because you're going through the same thing. So it's not like you get a prize at the end. You all get the same license.
The definition of competency is to be suitable in your skill and knowledge. Like, that's the thing, is just suitable. It doesn't mean perfection. It doesn't mean like all-knowing. I just have to be competent. I just have to feel that whatever I'm doing is enough for me and enough to show my instructors that I'm still willing to learn and try to be better.
For students, you will graduate. You will be able to do it. That's what they tell us. They're like, everybody's graduated, you become a hygienist, and you keep learning, like outside of school. You know, school's not the end.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists podcast, episode number 457. I'm Andrew.
And I'm Annie.
Okay, I got one for you, Annie. You ready for this?
Yes, I'm ready.
It's about a product.
Okay.
And listeners, this is not like no one's getting paid to talk about this thing. It's just, it was interesting because like when you're in social media, like in the forums and stuff, I mean, there are some like really popular topics. Like someone will post something and they'll be like, oh, wow, there's a lot of responses. But anything like between like 50 and 100, like, oh, that's a pretty popular post, right?
Yep, a lot of engagement.
This one, and okay, so speaking of engagement, there's another interesting thing. There'll also be, in addition to that many comments, there will be 200 likes or hearts or whatever, right? Okay, so this one is in Facebook. It only had 75 hearts and likes, but 270 comments.
Oh.
Yeah. And so you know what that usually means, though, right? It means it's a dumpster fire of a question. It means like it is the worst catastrophe.
Yeah, controversial.
Super, right? Okay. This one's not controversial, though.
Oh, okay.
Okay. It's about a product. 270 comments about a product. Who does? Okay, come on, hygiene. Okay. So I don't remember what group it's in. I apologize. I'll just use her first. Actually, I cut off her profile picture too. I assume it's a her. Jamie posted something about a new fluoride. They just had a rep drop off some samples. There's no residue. There's no residue. Can apply before exams. The only point of interest is no eating or drinking for 15 minutes, which that's not all that uncommon. Depends on hot temperatures. Anyway, it doesn't matter. I tried it and felt like it washed off my teeth immediately. Not quite sold. The rep, who was a hygienist, stated that it immediately absorbs. Would love to hear the feedback. Now, the feedback it's interesting because this is a product from 3M.
I was just say,
I think people
3M?
know ClinPro, right? ClinPro is very well known. It's 2.1% sodium fluoride, which is usually, it's less than normal, right? And yeah, I have no science or evidence about this, but 270 comments. So first of all, I want to ask, like, have you heard of this one?
It's interesting you said that because I actually just did an unboxing video for this product.
Oh, you did?
I did.
I mean, I totally knew about that. We're always engaged.
I don't know if they pushed it out yet or not. I'm not.
Oh, then that's why I didn't know. Yeah. Let's just use. Okay.
I don't know when it's. I don't know when they're pushing it out. Off the top of my head.
So that's okay. So that's interesting to me because well, let's first of all. Sorry, I'm hijacking things again.
Okay.
Tell me about the unboxing thing. Like, tell me what your experience was. What did you think about all of this stuff? And then I'll tell you some of the things that I saw in the comments.
For sure. Well, I mean, one, yeah, and I talked about this in the unboxing that it's 2%, and so I was like, why not 5%? Because we're all used to 5%. And I asked them this at the last trade show I was at as well, because I was curious about that. And they have studies that have shown that the 2% that they use, it is still readily absorbed just at the amount as 5%. So it's still the same amount, and you're still getting that same amount, just not as much as you don't need that 5%. Right. So there's that. I liked the product. I liked the design. I like that you can easily, it comes like an L-pop unit dose. So you just like squeeze it and it comes out. And so I feel like that was really efficient. I like that it goes on clear. I've tried it on myself. I've tried it on patients. I thought that the feedback was really great in the sense that there's unflavored options and there's also like other flavored options as well. But I like that it's clear and that it goes on easily. It's not super thick like some other varnishes that I've used, and I'm sure some other hygienists can relate to that patients will leave and it doesn't look like there's fluoride varnish on your teeth. And I could see where maybe some hygienists said it feels like it wipes off their teeth, but it readily absorbs like right away in a wet field. And so I don't know how you could like say that, oh, I feel like it just came right off my teeth, because it starts absorbing right away. So that's where
if it's absorbed, it's not like a thick layer on your tooth. Like it's absorbed. It's not there anymore.
Right.
And the part that you normally would feel that's like left behind is not necessary because it's already absorbed.
Right.
Kind of. Yeah. So interesting. You hit a lot of the points that were talked about, like coming in the forum.
Yeah.
The unflavored is interesting because actually people loved the unflavored.
Yeah, I feel like it's great.
Who freaking loves unflavored?
Unflavored. It usually tastes really weird. Like it's unflavored, but still has a taste. Like
it's chemically.
Exactly. Yeah.
But
no, it truly like I feel like it's truly. The one that I actually unboxed was the watermelon. But I was given the unflavored option too.
See, that's so. Anyways, just fascinating, interesting. Again, this isn't sponsored by 3M or anything like that.
Yeah.
3M, if you're listening, let us know because we would happily be able to
absolutely
put some sponsorship on this
Yeah,
thing.
I think it's a great product.
That's the thing is like, we all use Clinpro, or a lot of us use Clinpro.
Yep.
It's a household name. Everyone understands, what they're all about.
Yep.
So, but yeah, that at 2%, I'm glad that you kind of addressed that a
and
little
they have
bit.
the research behind it that shows it, and it shows like how it's like readily absorbed, and it like compares it to 5%. It shows it's equally as effective.
It lends to the bigger picture though. Are hygienists willing to change? And I mean, so from 5% to 2.1% or wherever it was, that's suggesting to us that there is technology that is advancing and that is being implemented in the products, right? We are so married to the 5%. We have to be 5% no matter what. I think the ADA actually has a recommendation, maybe someone had mentioned, about there being a 5%. And I just think that that's interesting where are we in a position in our careers where we're like, oh, well, we'll give this new thing a try? Or are we just like, you know what? We love our Walter Berry or whatever from Ultradent. That's what we're going to use. Or we're going to use our Delish from Young or whatever, I'm trying to be fair and balanced, all this stuff. Those are also very delicious brands as well.
Yes.
Are we willing to move off of what we are currently using? And why would we? Like, what would be the impetus to push?
I think the impetus to push is that, I don't know, I'm always wanting to embrace change and I feel like that's just like healthcare in a nutshell. Like we should be wanting to like pursue new things for our patients. Like if things are becoming better, and obviously like the rationale behind, the 2.5% and clear varnish, like these are all things because they were created based off of patient feedback and hygienist feedback. So like, why wouldn't we want to pursue that? Why would we be stuck in our ways? And like, it's just like, I'm going to say this, like, chlorhexidine and like those things. It's like, there are other options. So like, why not? Like, and I think that just really, you have to look into the research and all that too. Cause I know hygienists would be like, well, this one thing works. Like, why would I want to change? But
Exactly.
it's like, yeah, but there's something better.
But quantify better. I guess that's as a hygienist, I'm like, oh, just quantify better. What is it? Marginally better? Is it significantly better? You know what I mean? Like
Maybe it's not like,
better.
I don't know. I guess quantifiably, like, I don't know if you could like say that, but I think more like from a subjective standpoint, like patient feedback and hygienist feedback, like I think that's like a part of like evidence-based practice. Like it's not just the research, but it's like the clinical experience and the patient experience. Like I think that's a big part.
Interesting. Folks, I'm really sorry. I would link to whatever that is in. It could be in any number of hygiene groups that we're in. I apologize about that. But it's interesting, kind of dovetails into like our episode today because we're talking to students in this particular one. And by the way, I'm so grateful to be back to doing like student roundtable stuff. I hope we can continue this.
Me too.
Listeners, if you are a student or if you're an educator and you think that it'd be really cool to do a student roundtable, you have maybe a couple of students or maybe some faculty in your school and you're like, hey, let's just get on and just like shoot the breeze on a podcast. Man, we're more than happy to have you on. Andrew at Tale 2 Hygienist, you can reach out to me. We'll schedule with Annie and we'll get it going. But we had a group of students on today and they had reached out. Shout out to Jessica Atkinson, by the way, who is a good friend of the show. She's been on the show. You might have heard her voice several different ways and times on the show. But Hygiene Edge she's a part of the Hygiene Edge group, and they do really great work. Check them out. Make sure you do that. But she had helped her students find us, and then they wanted to have an episode about kind of like what it's like to be a hygiene student in this day and age, but also kind of, there's a whole confidence level. We talk a lot about competence and confidence in this episode. We talk a lot about expectations, what they thought hygiene was, what it ended up being so far for them. One thing we didn't talk about, I really wish we would have talked about it more, is like the next step, like if they're nervous, to get out into the real world, or if they feel they're ready.
Yes.
It's a question we'll have to ask them next time they're on, but it's a really good episode. You work with students all the time. I'm sure this is a Friday afternoon for you.
Yes. Yeah, for sure. But I was just thinking, I'm like, I would like to bring some of my students onto the podcast.
Hey, let's do that for next week or next month.
Okay, let's do it. I'll get that rolling.
That'd be great. But again, if you are out there listening and you want to do a student roundtable with us, just let us know. Or, even if you are a clinical hygienist and you have questions for students about what their experience is now, because by the way, I said this on the podcast, like it wasn't that many years ago that I graduated.
Same
and
here.
things have definitely changed.
So
definitely changed. So anyway, and then next week we have another episode for you, but I forgot to look at what it was, and so I don't actually know what we're talking about next week. I think it's Ed and Carrie are coming on to talk about kind of like the hygiene shortage, but I'm not 100% for sure on that one. So TBD on that one. But thank you so much for listening, everyone. Please make sure you reach out to us. Make sure you reach out to all of our guests. Follow us on social media. Sign up for our newsletter. Do all the stuff. And with that, here is our student roundtable.
A tale of two hygienists.
Our listeners, welcome into the interview portion of the podcast. Joined today by Kasidee, Rylie, and Bria. Thank you, ladies, for joining us today.
Thank you for having us.
For having us.
First of all, y'all look a little bit nervous. Are you okay with this?
We've never done anything like this.
This is a big podcast.
No.
It's kind of a big deal that you guys
It's
do.
not a big
I'm just
deal. It's
kidding.
not a big deal.
No,
at all.
I know. I'm just kidding.
Well, we were talking beforehand. Y'all had like really good ideas, and
Yes.
we want to talk about this, and all of a sudden it's like deer in a headlight. As soon as we hit the
I
record
know.
button, so
We saw the record button going.
Yeah.
It's the pressure.
yeah.
Go time.
Well, let's do this. Let's start off. First of all, for the audience listening in, we talked about this a little bit on the intro, but this is a student-focused roundtable podcast, and this is something that we wanted to kind of get back to. We've done this a long time ago, and we haven't really done it in probably the last couple of years. But it's a good opportunity, I think, for us, maybe more established / veteran hygienists, to hear from the incoming classes and what they're experiencing in school and what you're learning, and also kind of like the problems that let's be honest about some of the stuff that you guys are enduring and having to go through. And, public perception's a whole different thing. I know we want to talk about that a little bit later on too. So before we get into some of these things though, if you all take a minute just to introduce yourself and maybe just, who you are, where you're from, and then, kind of like the whole why do you want to be a hygienist? Like what got you interested in hygiene? Kasidee, we can start with you.
I'm Kasidee. I'm originally from Logan, Utah, Cache Valley area. Currently a senior at Utah Tech University, the dental hygiene program in St. George, Utah. And the reason why I've decided to go into oral healthcare hygiene was I had a really great experience with a hygienist when I was younger. I used to have really bad dental anxiety actually when I was younger from just different experiences. And she would take every appointment and just sit down with me and only do what I felt like I could do in that appointment. And it made me feel more heard and seen. And ever since then, I was like, I want to be that advocate. I want to be that friend in person for someone that can change that fear that maybe someone has and help them overcome that. So
That's so wonderful. Thanks for sharing that.
So I'm Rylie Ellis. I am also from Logan, and I am also a senior at Utah Tech University right now. I think my why is probably, I knew I wanted to go into something medical. I didn't really know exactly what it was. I just knew that I had an urge to help people, and I was kind of exploring different options. And I ended up being a dental assistant in Ephraim as I was going to Snow College, getting my just general. I didn't even know what I wanted to do, but I was just getting generals done. And I fell in love with it. I thought it was awesome to see how different people can be once they have confidence in themselves, and being able to watch a dentist restore someone's smile and then them just be a totally different person was really inspiring for me. And so I wanted some of that. So that's my biggest why.
That's
I love
awesome. Love that.
Okay, I'm Bria. I'm from Parker, Colorado. I'm also a senior at Utah Tech. And my why, I think, is, well, I thought I wanted to be a nurse. And my sister was like, you get too grumpy when you're tired. So working 12-hour shifts may not be the best for you. And so I thought about it. I love like working with people. I was a CNA before. I still work with some elderly people, help take care of them. And so I just like love interacting with people, and dental hygiene is better hours. You don't have to work 12-hour shifts normally. And so, but my main reason was just to be able to work with people and to be able to improve their lives.
So are you kind of a grumpy butt at school? Because like it's long hours.
I guess you could.
Tiring.
I don't know.
I mean, look, this is the honesty. Like no one else will hear this. It's just us. So
I feel like when I'm at school, I'm pretty happy. My husband probably more gets the brunt of the grumpiness when I come home.
Yeah, that's fair. That's fair. Just side note, Rylie and Cassie, did you guys know each other before? I know Logan's not a small place, but you never like ran into.
No, we didn't. We went to rival schools, so that's probably why. We just were too against each other, but
Not with the enemy, no.
We're going to get into some competition and competitiveness in a minute. That's interesting. Let me ask this before we get into some other ones. So multiple schools in Utah. I'm really bad at geography. Logan's more north though, right? It's not down St. George area.
Yeah, it's like pretty much all the way north.
And then Colorado is also not near there. So why did you guys pick the school you picked versus any other one that was out there?
That's a good question. I think for me, it was based off of certain things that are specific to our school. So for example, at our school, we get to have exposure and experience to like restorative dentistry and be able to have a little bit of experience there. And so for me, it was more like what sets the school aside from the other ones and what do they offer that maybe the other ones don't. So yeah.
It's great.
Yeah, I agree with that. I also did my prereqs at Utah Tech, and I love St. George and the weather down here. And so it was kind of my first choice. And there are quite a few hygiene schools in Utah. But yeah, Utah Tech was my first choice, and I've loved it. So, and I had always heard good things about it. Like I had my hygienist that I went to go see, she graduated from Utah Tech and she loved it. So
nice.
Great. I would say for me, I went on a tour. I originally played on the soccer team here before. And so when I went to a tour for the soccer team, I decided to go check out the hygiene program too here. And we're really big into like working with the community and networking. And at the time, we had this huge like motorhome bus we used to use. And I was like, that thing is so cool. Like I want to go on there and give like oral care help to the community. Now we have a van. It's a little bit different, so it's not as big, but that was one thing that really stuck out to me is like how much we did as a community to help with access to care.
How much when you were, selecting the program, how much work did you think it was going to take to be a hygienist or to at least go through school? Is it more work than you thought it was going to be? Is it less? Is it right on par?
More.
Definitely more.
I always heard it was hard, but I had I didn't know, I guess, like, I've done hard things in my life, but it's like, it's just like it's mentally hard. You do a lot and you're always busy. And like last semester, so our junior year, we were taking 21 credits and we were just starting to see patients. We were doing anesthesia. So it was just, a lot at once. And yeah, it's a lot, but there's good and bad to it, like you make friends and you have friends and you have that support and stuff. But I would definitely say it's harder than I thought.
I was going to say, do you feel like you kind of touched on it a little bit, but do you feel like it's the coursework, or do you feel like it's like being in clinic and like seeing X amount of patients, or I don't know if you guys are required to find your own patients. Okay, same with the university where I am at, where students are required to find their own patients. So what do you feel like is it everything, or what do you feel like is like what surprised you as far as like what's hard?
The amount of tests.
The amount of tests. Okay.
And I feel like finding patients is hard, but then I feel like you find them and you're like, now I have too many patients almost, where you're like giving them away. But at the beginning, you're like, it's so hard to find patients. But
yeah,
I feel like especially last semester, it was definitely like we probably took at least 2 tests every week and we had one every weekend. And then sometimes it was like 4 or 5 tests a week. So
How
Like, it's
long
just a
is
lot.
your program?
It's 2 years, so it's 5 semesters because we
years.
go in the summer. So
In the summer. Okay. Yep.
Do you graduate with a bachelor's or is this associates?
yeah, we
Bachelor's.
Mm-hmm.
Nice.
Great.
Okay. That makes a lot of sense.
Yeah.
It's interesting because, we think back to kind of when we went to school, a lot of this so far sounds very similar. We had almost a test a day, right? Because it seems like if you're doing a test every Monday in, anatomy or whatever, and then you have another test and, something else, materials or something, it just seemed like you had like a test or a quiz at least, like something was always going on. And it does kind of, it's a grind, right? Like it's a continued, never-ending slog of learning and application.
So much
to the
information.
learning.
Yes.
How do you feel? Let's go back to so Rylie, this is kind of more for you about competition, right? Like the competitive nature and how that has changed in school now compared to before.
Yeah, I think that at first I was still in that mentality of like, I have to be the best, I have to do the best, I have to get an A in every class. And it was draining because obviously, like we talked about, you're taking 21 credits, plus you have clinic, plus you have patients. You can't give your 100% in all of the areas. Like there were some things that you just couldn't do it. And so I feel like naturally you kind of start to make this shift of, okay, well, I understand this class a little bit more than I understand this other class. So I'm going to not focus my efforts so much on this one class when I used to study for hours and hours for one test, but now maybe you reduce the amount of time spent in the one class and you give it to another class that you're just trying to pass. And so I think that, and also like we're not competing for anything anymore. We're just seriously just getting through the program. And so there's no need to compare or compete with the person next to you because you're going through the same thing. So it's not like you get a prize at the end. You all get the same license. You know what I mean?
The whole competitive nature thing is fascinating to me because you're right. In order to get into the program, you have to have basically a 4.0 or extracurriculars or leadership or service hours or this or all of these different things. They only take so many people, right? And so you're like, okay, well, I want to get in. I want to make sure I do all the things. And then you get in and you're like, you're hitting the ground running. You're trying to get A's and everything. Did anyone ever talk to you about the idea of competency versus letter grades? Have they made that shift for you all yet?
Yeah. I would say our program director, Brenda Armstrong, she's talked a lot about it. And that's something that's like changed my perspective because the definition of competency is to be suitable in your skill and knowledge. Like that's the thing, is just suitable. It doesn't mean perfection. Right. It doesn't mean like all knowing. And that's changed my shift, at least like what Rylie's talking about, because I felt that same way the first semester of school. I was like, I have to be as good or if better than the person next to me on my left and right. And it was such a big relief once I first got my like first B or C. I was like, this weight just came off. I was like, oh my gosh, I don't have to be perfect anymore. Like I just have to be competent. I just have to feel that whatever I'm doing is enough for me and enough to show my instructors that I'm still willing to learn and try to be better. And I think Brenda's done a great job at helping us to see that we've come so far from where we're at and there's still so much to do, but that they're helping us do that together and there's people to like lean on and do that.
I love that.
Let me switch this to Annie because Annie's at a different program. So bigger picture for the audience, I would say probably at mid 2010s probably, there was a big shift, not necessarily in hygiene, but in education, higher level education, to be competency based as opposed to kind of the test scores and things like this. It's how a lot of these degree completion programs work nowadays. WGU being one of them, be competency based, and so I was wondering if it was kind of filtering in kind of across the board. So, Annie, do you guys talk a lot about competency as well, or is that different for you all?
I feel like that's a little bit different for us. I feel like I talk about a competency a lot with my students. I don't know how much, because I'm with them mostly in clinic, so I don't know how much they're getting that in their didactic curriculum. But I was just having this conversation with them last night, and I'm so glad you guys are bringing this up because I feel like I was that student as well. I wanted to, that competitive nature, needed to get the great grades and everything, and I'm trying to get my students away from that because even when they're in clinic too, they're really focusing on like how they're, how much calculus they're removing and like the grade that they're getting for that patient. And I'm like, you guys, like, I need you to focus on just the patient care itself. And like how one of you had brought up about, I think it was Kasidee, about your experience and then how your hygienist really sat down with you. And I feel like I want my students to be that way. I want them to be competent providers and not focus so much on the grade that they're receiving in clinic. Yes, that's important, but I think just the competency aspect and just being, and I say adequate, but just a solid provider once they graduate. It's not all just the grade. That's not. I want you to be a good clinician when you graduate, and that's my goal as an educator. So, I don't know how much we're focusing on that, the competency part of it in our program. I was actually just looking at like the CODA requirements earlier today because I'm working on this presentation, and I was like reading through as far as like, and it's competency is a big part of that.
Yeah. Yeah. I think it also just helps levels. It's the mindset, right? It's the mindset of it gives them a little bit of breathing room.
Yep.
And I think going into your boards, have you guys taken any of the boards yet?
Yeah, I was going to ask that. Have you taken anesthesia?
Which ones have you taken?
Anesthesia.
Just anesthesia.
Yeah.
Okay.
Just anesthesia.
For you all, is it a written and a clinical or just clinical?
Written and clinical.
Yeah, the written is mandatory, but the clinical is optional, but I think we all plan on taking it. So
Okay. Yeah. So you've taken, I'm sorry, you said it was the written that you've taken already?
And
yeah.
When is your clinical?
It'll be spring semester
like
at the
April.
end, like March, April.
My students just did their clinical not too long ago.
Did they?
Yeah.
And that's I guess they go back to the competency. This the whole thing is like the mindset going into a clinical exam. Like there's people looking over your shoulder, and there's the people that you don't know. They're like, oh my gosh, they're looking at me and grading me and looking and judging, and it's just like, look, it doesn't have to be perfect, right? It's just like you have to be safe and you have to basically get it right. And there's so much variance for mistakes.
100%. And with that, with the clinical board, I mean, it's just the IA and the PSA. And like, I was working with a student last night and she was giving an IA and she kept contacting Bone and contacting Bone and contacting Bone. And she was like, Ms. Walters, can you just do it for me? And she's like, I don't have time to just sit here and keep contacting Bone. But kind of going off what Andrew was saying, I stepped in and gave the IA, but it wasn't correctly exactly anatomical like the textbook says. And so like Andrew was saying, like the competency part of it, as long as we're being safe, and I was explaining that to the student, I'm like, it's not, as long as you're not going to be exactly how it is, but I had to angle my barrel of my syringe a little bit to get more posterior. And so that's where that competency comes in.
I want to talk a little bit more about competition within your classmates. So you all feel a certain way, but do you all get along for the most part, or is there kind of groups?
Oh, yeah, that's a good question.
I feel like there's always groups, but like, what does the makeup of your class look like?
I feel like we all get along. I feel like we're all like friends. You could talk to every single person there and like them. I do feel like we do kind of have like more groups that study together. Like we became good friends, and there's a few of us, and then but everybody kind of has that person that they like get along with better. But I feel like for the most part, we're all pretty good friends.
So my assumption that if you all kind of get along, then there's a lot of good like group discussions and things like that. Do you all feel a sense of pressure and anxiety and things like that? And if so, do you feel like it's normal level like you've heard the rest of us have gone through, or do you feel like it's heightened compared to past years?
I feel like it's normal with like any competitive program. I think it's not anything that's different than probably what you've experienced. I think, of course, things change compared to like what was developed and what technology and things maybe you had then compared to now and stuff like that that's related to that. But I feel like it's the same stresses of being in just general classes or with the program. And it's just focusing on time management, trying to balance outside life with the program, trying to stay on top of things within the program, and then staying in touch with your family and friends, like kind of just life in general. But it's not anything that's...
Didn't even know you get to have family and friends.
Right.
I know, right?
A life outside the program? What is that?
Oh, yeah, you're living the cushy life over there. Wow.
I say that like I have it, but I mean, it comes and goes.
Have there been any surprise obstacles or hurdles that you all didn't anticipate before you went in?
That's a good question.
That's a really good question.
I'm a podcaster.
I feel like I hadn't really heard about the fact of finding patients and how much of a stress that is. because then like once they were like, oh, you have to find patients, you know, some people were like, oh, I heard people from a different school, they don't have to find patients, you know. And so it was just one thing, because I was like, obviously like we're gonna have clinic and you have to learn all these things, but that's like one other thing you have to do. And so that was kind of something that I didn't even like consider finding patients like when I was applying for the program or being a hygienist, you know.
Yeah. But by the way, I didn't know that was a thing either. I also didn't know that hygienists gave injections.
Yeah.
So
I did not either.
I'm a dum-dum.
I feel like I
just
didn't know either.
anything.
I didn't grow up with a hygienist. I never went to a hygienist growing up, so I didn't know anything. So I hear you guys, and finding patients is challenging because you kind of feel this weight of like, well, like if I want to graduate the program, like I have to be able to find my patients, and that's really stressful.
Yeah, especially finding patients that meet the requirements that
absolutely the code requirements. Yeah,
and I think that was probably one of the biggest shockers for me is you don't really know. I mean, you have a little bit of an idea of what's going on in someone's mouth, kind of, but not really until they're in your chair. And I feel like that's a really difficult thing to be able to gauge that and then get all of those requirements while balancing different aspects, because there's obviously like different demographics you have to see and all that. So yeah, that's challenging.
I think going along with Rylie, just to bounce off that comment, the thing that surprised me most recently, especially like these last 2 semesters, last spring and this one, is how like subjective hygiene and dentistry is in general. That's something that really has surprised me, because I feel like being the patient and being in the chair, I had this perception that everyone had all the same ideas and that there was only one way to do things. And then I came to school and it's like, oh, for this patient, you could use the piezo or the ultrasonic. There's not just one option. Or like, oh, I think this is a heavy deposit when actually it's just a moderate.
Grainy.
Like,
or
it's grainy.
Aging and grading. Like one clinician will think it's a stage 1, but someone else will argue it's generalized gingivitis or like, you know, so it is very subjective.
You all didn't grow up with those commercials where it's like 4 out of 5 dentists, you know, prefer Trident or whatever. And that's really what told me that, okay, not all dentists are right. But here's the thing. I really want to get to something. Cassie, you actually had submitted this when we were talking ahead of time about confidence. You all seem very the fact that you're taking time on a Friday afternoon to record this with us. How do you have time for this? That would be so stressed out just by doing this. But you all seem to like have a fair amount of confidence in what you're doing. I think that there's lots of elements of why, and I kind of want to identify some of those because I do a fair amount of traveling and I see a lot of students, and there's a lot of people struggling out there right now, and they don't believe in themselves, and they're kind of beating themselves up a little bit, and we know they shouldn't, but I think I'm too far removed. I don't know how to help them anymore. So I'm hoping you guys have some good ideas for that.
Yes.
I just think back to our instructors and just leaning on people that you know believe in you, because I know that for me at least, like I feel like I'm not doing my strokes right. I feel like I'm not doing anything, and then they come over and they're like, it looks beautiful. And it's something that I've never done this before. And so having that reassurance that I'm doing something right is nice. And I also think Jessica Atkinson, who we have in common that we know, and who is our senior clinic instructor, she has stressed to us this past semester that not only do we need our patients to come into and be in our chairs so we can help them out, or so they can help us out, but they also need us. And if anything, they almost need us more than we need them. And so I think that having that knowledge of, okay, like I am a student, but I'm also out here doing good. And I think having that it's empowering, and it gives me a sense that, okay, I am making a difference, and I can make a difference once I get these skills down and get out of hygiene school.
I don't know about your guys' clinic, but at least with ours, we see a lot of, we work a lot with the public and obviously public health. And so we see a lot of patients that are very periodontally involved, and that can be really overwhelming for a student, especially when like in a practice setting, like this patient should see the periodontist, but this is like, they're coming to us because for a number of reasons, lack of access to care, low income, whatever the case may be, limited insurance. Do you guys find that, if you're ever in those instances, do you find that to be overwhelming? Or like, I'm kind of going into the space of like limiting beliefs, but as far as like Have you ever encountered that situation where you're like, this is so much, I don't know if I'm capable of doing this? Because it kind of goes off what you were saying, Rylie, in the sense of like, we are still helping the patient. Have you ever encountered that situation?
I definitely have, for sure. We were kind of talking about this before we hopped on this podcast, how sometimes like the unknown expectation that's just out there puts like a limitation on that possibility. And I was actually listening to one of your past podcasts, Andrew with Whitney, and she was talking about how there was this instructor and she felt like she could only use that specific instrument, or like when that instructor was there, to feel like she's successful. And we're like, we felt that with our instructors too, because everyone does. They have their routine and they love doing it because they know it's successful. But the thing is, it's not the same for everyone. And that relates right back to confidence. Like what Rylie does to be confident is way different from maybe what I do. And I think that's hard because it's like there's not a universal like ingredient and recipe to be confident, but there's like simple things that you can do that help you to find what makes you confident. And I think that's what helps with like those limitations, is like realizing that someone's challenge is different than what you kind of go through. Like it's all just like interwoven. It's just so cool. But
I love that. That is so great and so powerful. Thanks for sharing that. I really love that perspective.
I feel like 25 minutes goes by so fast, and I feel like I didn't really give you a chance to answer all of the questions that we talked about beforehand. Before we wrap up, is there anything else that we need to talk about that you think that would benefit either established clinicians that you're going to be joining the forces with, or other students, or maybe even faculty?
I think for students, you will graduate. You will be able to do it. That's what they tell us. They're like, everybody's graduated. You become a hygienist and you keep learning, like outside of school. School is not the end. And there'll be things you see, and there's different dentists that you work with. And so you learn the basics in school, and then you go out into the world and you learn more, but you will graduate. And that's what I keep telling myself, is I will graduate. I will get licensed.
You will.
So.
You will.
Yes, you will.
You absolutely will.
All right. So, well, let's wrap up then. Kasidee, Rylie, Bria, thank you so much for being on.
Thank you all
Are
so much.
Thank you.
Willing to have people message you if they have any questions for you specifically?
Yeah,
for sure.
How might they find you?
Our email.
Yeah, or like
I'll
social media. I don't know if there's like social media too. We have social media.
I can put all this in the show notes. So if you guys want to just like say it out loud, and then
mine's Bria.Riser.
clever.
Super exciting.
Mine is Rylie_John, and it's spelled RYLIE.
Mine was from when I was like 12, so please don't judge me. And I haven't changed it. But it's Sassy Cassie 7. Yes. Maybe I'll just do my email because that's really
Where was the sassy on this podcast when we needed it? Oh my goodness.
I don't know. You need to get me fired up.
All right, look, next time. Look, now that you've all done it, are you starting a podcast? Is that what I'm hearing?
That's our plan. That's our goal.
Great.
Okay. Look, when that airs, you let us know. We'll have you back on. We'll push it out for you guys.
Okay, we would love that.
All right.
Thank you.
Thank you, everyone, for being here.
Thank you, guys.
Thank you.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.